All right, I think we are ready to go. Kathleen, are we ready to go? Okay, thank you. Good morning, everyone. I'm Dave Eaton. I'm the chair of this committee. I'd like to welcome you here. I have a little blurb I need to read you as this is a public meeting and tell you a little bit about this workshop. So this task is being undertaken by this committee of the National Academy of Sciences, Engineering, and Medicine to evaluate the available evidence of the health effects related to the use of electronic nicotine delivery systems, or ENDS, and to identify federally funded research needs. As part of its work, the committee will conduct a comprehensive and systematic assessment and review of the literature. A full statement of task and a list of specific questions posed to the committee by the Center for Tobacco Products are available at the registration desk outside of this room and for our virtual participants on the website. If people are looking for this, the Wi-Fi in this building is called Visitor, and there's no password needed. If you are so disposed to tweet, there is a hashtag. It's eSigHealthEffects, one big long word. So I would like to give some sense of the format of today's meeting. The committee will introduce themselves very briefly, and then we will begin the workshop. We've organized 4 panels for today, and a committee member will share the responsibility for chairing each of those panels. I want to stress that the purpose of this workshop is to educate the committee on specific issues that we've identified so that we are best positioned to respond to the important questions that the CTP has posed to us. We've asked the speakers to be mindful of the time allotted. Kathleen Stratton, sitting here in the front, will hold up a yellow sign when you have 2 minutes. There it is.
3 minutes.
3 minutes?
3.
Okay, good. 3 minutes remaining, and the sign when your time is up, the red sign. We'll allow a short amount of time after each talk for questions of clarification of fact from the committee members. There was an opportunity for more engaged discussion at the end of each panel. Committee members will have the opportunity first to ask questions of the speakers, and time permitting, then other speakers, and then the audience in general. People watching the webcast can email questions, and time permitting, if the question has not already been asked in some form, we will read the question. Dr. Pamela Dalton was unable to speak with us today, so we're going to have a special brief virtual session with her tomorrow at 9:30 a.m. That presentation will be available to the public via WebEx. Information on how to dial in to that brief session is available on the website. There is no in-person venue for this discussion. So at the end of the day, we'll have allotted 30 minutes for public comment. Comments should be limited to 3 minutes and address issues related to the committee's charge. If you have more than 3 minutes worth of comments, we're welcome to hear them, but please email them to Kathleen Stratton, and she will forward them to the committee. Any public comments distributed to the committee must be put on our public access file, so they will become public. Kathleen can answer any questions if you have them on that. And please be sure to sign up to make public comments at the workshop registration table so we have a list of the people wishing to make comments. I want to remind you that this is an open, on-the-record session. This is being shown in real time via the Academy's website, and the video will be archived for viewing after the event in a few days. I would also like to remind everyone that this is an information gathering session. That is, the committee is in the process of assembling materials that will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here thinking otherwise. Committee members, comments made by members of the committee should not be interpreted as positions of the committee or of the academies. In addition, committees members typically will ask probing questions in this information gathering session, and that may not be indicative of their personal views. The committee will deliberate thoroughly before writing its draft report. Moreover, once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee, and the committee then must respond to this review with appropriate revisions that adequately satisfy the Academy's report review committee and the NAS president before it is considered an official Academy's report. So now I will ask the committee to introduce themselves briefly, and then we will launch into this session. I will start. I'm Dave Eaton. I am the Dean and Vice Provost of the Graduate School at the University of Washington in Seattle, and my general area of expertise is in toxicology and chemical carcinogenesis and drug metabolism.
I'm Nancy Brigatti. I'm a primary care physician, general internist, and clinical researcher at Massachusetts General Hospital and Harvard Medical School.
I'm Maciej Goniewicz at Roswell Park Cancer Institute. I'm toxicologist and pharmacologist.
Hi, I'm Ken Pinkerton. I'm a professor of pediatrics at the University of California, Davis. I'm an inhalation toxicologist.
I'm David Mendez. I'm an associate professor in the Department of Health Management and Policy at the University of Michigan. My expertise is on operations research and system science.
My name is Richard Miek. I'm a professor at the University of Michigan, social scientist by training, looking at transit drug use among adolescents.
Gideon St. Helen, assistant professor at the University of California, San Francisco. I focus on the clinical pharmacology of electronic cigarettes.
Tony Alberg, Hollings Cancer Center at the Medical University of South Carolina. I'm an epidemiologist.
Andrew back there, too.
Thanks. Adam Leventhal, Associate Professor, University of Southern California. I'm a clinical psychologist and interested in behavioral determinants and consequences of tobacco and other drug use.
Hi, I'm Sharon McGrath-Morrow. I'm a professor of pediatrics at Johns Hopkins. I'm a pediatric pulmonologist, and my interest is lung development and lung injury.
Good morning. I am Ana Navas Hasian. I am a professor of environmental health sciences at the Columbia University, and I am an environmental epidemiologist by training.
So I think that's all of our committee. So it's my pleasure now to turn this over to Maciej, who's going to introduce our panelists, the first panel this morning. Maciej?